It's another conversation going on here in Amarillo, Texas. This is a show titled Conversations. Conversations is about a dialogue and never about a debate. Every guest or every host has his or her opinion or their tenets or their belief systems about things. And so tonight we've chosen to focus on mental health and probably specificity in regards to mental health with the African American men in the United States of America as a whole. And I was enamored with some things that I read in some other social mediums where one of our guests tonight, who will eventually become one of our hosts for different shows, is Miss Neeshuh Williams. And Miss Neeshuh Williams, I've watched grow up here in Amarillo, Texas, and she has done remarkable things. She has a youth of a wisdom that is very welcome to conversations. The narrative that she brings to the table is 21st century and millennial by all means. We also have Miss Amy Hord in our conversation tonight with Family Support Services, and they will give you their own personal titles. And we have Dr. Shay Grays, a native Amarilloan, who is a PhD clinician for a hospital in Dallas, Texas. I'm not going to give a whole lot of information about that. So welcome, ladies, to Conversations. And I'm going to start out with Neeshuh, and I want Neeshuh to give us a little synopsis of what stemmed you to bring about the conversation about, and I think specifically your question on social media was, what do you men do and where do you turn to when you have to vent? And it almost went viral in reference to the response. So, ladies and gentlemen, our own Neeshuh Williams.
Hello. Thank you, Mr. Grays. As he said, my name is Neeshuh Williams. I am a community advocate. And what really prompted me to pose the question, who do black men vent to? I have a whole bunch of friends, and I see them speaking on like things that they've gone through, but also in the same sense, there's no one they can turn to. Like, say for instance, there is a relative of theirs that was murdered, hearsay, or per se, I mean. There's no one they can go to. They keep everything so closed in. They don't want to be seen as vulnerable or feel like they're less of a man or looked at as weak. And we have got to get out of the stigma of just holding everything in, or it's not good for men to show emotions, or not good for them to cry and things like that. Crying is an emotion, and it shows that you're human. And so I feel that everyone should have someone to turn to, whether it's God, which is the main thing. That's the first person you should turn to if anything goes wrong in your life. For me, I have my mom and I have my brother. And so when things go wrong in my life, that's who I turn to. And I think everyone should have someone to look to when things go wrong. And so I don't think that it's a good thing to keep things all bottled up, because silent anger is a definite killer and it's dangerous. And I think people should vent more.
And Neeshuh, I so concur with you in that having grown up, in a home where, I mean, sometimes I was maybe told boys don't cry. But I'm grateful for having grown up with mentors and men in my life who were spiritually inclined. And so I began to learn, probably I was about 27 years old after I had turned to alcohol. I had turned to some other substances, trying to find a panacea or some type of escape from those emotional roller coasters, those pains that I did not want to be termed weak for allowing my emotions to be put out there in the forefront. And so I'm grateful tonight to say that boys don't cry, men do. And I am so glad that I know that I can go and cry me a river. It's like an old country and western song. And so with that being said, I'm going to turn to Amy. And Amy, what can you share with us in this segment about mental health, and specifically pertaining to men?
Yeah. So, men in general, and I'm really glad for what Neeshuh said and what you're saying because it's very relevant to what the statistics show and what research shows, which is that men in general are less likely to get to seek mental health services. However, men in general are far more likely to die by suicide. And the reason that most of the experts anticipate that that's the case is because women are more likely to seek out mental health treatment. And so if they're seeking out treatment, they're less likely to make attempts. And so that's one factor. African American men are 4 times more likely than their female counterparts to complete suicide. So they die at a rate of 4 times more than African American women. And so I think what you're saying goes very much along with that, that they're not seeking treatment. A lot of the reasons that are given when studies are done is that it is seen as stigmatic. It's seen as a sign of weakness. A lot of those things, and we don't talk about it. There's also a kind of a mistrust of the mental health profession, and so all those factors come into play. But what I appreciate about what you said is that men will cope with their difficulties and with their mental illness, but the way they cope may not be the healthiest. And so how it manifests is, just like you said, it'll be alcohol, drugs, domestic violence, anger, job loss, a lot of different things that result from that. And so it does come out, but if it's not taken care of in the early stages, then it shows up in other ways. And then they further have difficulty with their life circumstances. And so it makes it really hard. There's not oftentimes that you see someone that's got a substance abuse addiction that hasn't had some kind of communication difficulty or trouble with coping in general. And that's because that's how they cope. And so it affects not only them, but their family members, their community, and their jobs in a lot of different ways. And so it's definitely, I really appreciate this conversation. And because I've had a community partner tell me that Black men don't seek mental health. And it just hadn't really hit me. And I started thinking about our population of clients that we serve. And I thought, that's par for the course for us. And it breaks my heart because everyone struggles. The statistic for about 11% of the population has depression, I think is the right number. And so if that's the case, about 1 in 10, we're definitely not seeing 1 in 10 of our population coming in for counseling or for treatment. And so there's also a shortage of African American mental health professionals, which would kind of help ease that barrier. So lots of different factors that come into play.
So we're saying that like cultures do bond. Mm-hmm. And I'm more susceptible to thinking that someone who looks like me would be more comprehensive of the social ills with which I am plagued sometimes.
Sure.
And not only social, but my own personal foibles on the weaker side. Thank you so very much, Amy. I'm just awestruck at what this conversation entails and the details, how this gets scoped into. There is opportunity for all people, specifically men, African American men, to seek help and not to feel weakened by the fact that asking for help is what helps. And suicide rates amongst the 18 through the 35-year-old African American male has exponentially multiplied in the past, I think it was 7 to 10 years. Right. And I'm gonna ask Dr. Grace to chime in and share insight based on what you've heard in the conversation, and just find it at your will to share your expertise in the field. So, Dr. Grace, thank you so much for being a part of this conversation. Chime in on what it is that you know from your clinical experience in regards to mental health across the board, male, female, but specifically the African American male, if you will.
Absolutely. And thank you for having. I actually work primarily with youth, and I will tell you, these young men, specifically African American young men, come in, and I often see referrals for behavior issues. I rarely see referrals for any type of mental health issues. Oftentimes, the young men, it's always classified as a behavior issue. And thankfully, where I work, we actually do depression and suicide screenings on all of the patients who come into our clinics. So I have a unique opportunity to sort of delve a little bit into providing education and providing some guidance to not only the patients but their parents as well in terms of mental health. And I really try to normalize mental health. I explain to my patients mental health is just like if you were diagnosed with diabetes or a heart condition or some other medical condition. It's just that the mental illness is in your brain. So I try to start early on so that we can sort of cut off these young men becoming men who don't know how to express their feelings, who are socialized to be strong. You don't cry, as the panelists have already said. They're just socialized not to express any emotion. And so typically the emotion that we often see is anger. That's what we see, or I can speak from my practice, that's what I see most often. And so again, I'm glad that my place of employment provides an opportunity for me to hopefully curb some of that just stigma and just the pink elephant in the room that nobody wants to address. Everybody knows it's there, but we just don't talk about it. And that's one of the biggest issues is the stigma. I don't want to be labeled as crazy. I don't want to take medication. I don't want to do this or do that. And I explained to them, if your doctor told you that you had diabetes, you wouldn't hesitate to take the medication. You wouldn't question it. You wouldn't question anything about that decision. But when we talk about mental health, there's just this stigma.
So awesome. When you talk about age groups, what age category, when you reference youth, are you referencing?
So the clinics that I work at, we work with ages 4 to 21. So I see high school up until early to mid college.
Great. Segue for a second. Do you have any other statistics that you may be able to share as far as case history with the African American male? Do you know about what the population of your census of those men would be with single parent homes? Is that a statistic?
Certainly, absolutely. We do see, and I don't have a specific statistic, but I do see a lot of, and I'll tell you that in my clinics see mostly Hispanic families, but of the African American populations that we see, oftentimes there is not a father in the home. There is a single mother. Single mother is working, and lots of issues as far as poverty and socioeconomic issues. That is a big factor when we think about mental health. That affects things like access to mental health. And so I can definitely say that with a lot of the African American families, again, a lot of single parent, not a positive male role model in the home, lots of behavior issues noted at school and things of that nature.
Wow. And I've been, a lady just last week shared with me that when acting out isn't acting, we have to take seriously those acts. And so thank you, Dr. Grace, for sharing such insight. I want to talk a little bit about low to moderate income families, and poverty is a major debacle for some of us. Neeshuh, what do you see in reference to kids who are embarrassed or they have some type of negative feeling about their living conditions, and they cover it with some type of behavior, 9 out of 10 times a behavior that needs modifying? So what do you see there?
What I see there, it could be because they have daddy issues or the lack thereof. Like like she said, there's no positive male figure in the home. So I can speak from experience with that. As far as I took it, my mom is a single mother, or was a single mother, should I say. I'm an adult now. But I took that as I see the love of my mom that her and my brother were giving me. So I felt like I was nourished enough that way because I was missing something from my father, but what I didn't get from him, I got from my mom and my brother. So therefore, I took that love and put it towards something positive and made sure I didn't act out. Anything that I thought I wanted to do or run away or like sneak out or do anything like that, I saw other kids do that, and I know that wasn't something that my mom allowed in our household. So therefore, I knew what not to do there. And I feel that some kids act out because they feel like they're missing something, or let me act out so I can get attention this way, or let me do this so I can feel this way, or I can be popular because I'm doing this. And it's a lot of, most kids grow up and they get friends because of their popularity. Like most people support popularity, not talent. And I feel that if you're not doing something negative, they're not gonna praise you for it. Most people do not praise positivity, and which is why I said what I said. And the reaction out of that comes from most of those people that I know come from single parent homes, and they feel that if there's no father there, then I have no one to vent to.
Wow,
And that's what I get from that.
awesome. And so, Amy, how would we tie peer evaluations and peer pressure into the behaviors of a lot of our young youth? And color is not a determinant of behavior. We focus on it because of the embarrassment and the vulnerable mindsets of some of our African American men who really need to seek mental health counsel. But across the board, what would you say about peer pressure?
Well, that's definitely going to be a factor for across any of the populations. And part of that, I think if you look at sociologically, kids that might be from single parent homes or their parents incarcerated, or they come from a mixed race family or something like that, then that, like, where do I identify, where do I fit in, and am I enough? So am I black enough, am I white enough, or am I Hispanic enough? Where do I fit in? And so that whole identity, especially when you're a teenager, identity is such a big struggle as it is. And so trying to fit into the right, the right group is definitely huge. But one of the things that I really appreciate about what Dr. Grace said is that sometimes things that show up when I've worked in the schools, things that show up are behavior, truancy, grades falling, things like that. And then for adults, sometimes it's actually physical symptoms, and all those things are masking true mental illness. And so the person may not be able to articulate that, but that's actually what's going on. And so sometimes we'll see that people have these vague symptoms such as, headaches, backaches, neck aches, and that may truly be the case, but it could be that they've got some kind of trauma trapped in their body, or things that when you don't cope with an emotion like anger truly fuels a physiological response. And so when those things happen, then it looks like something else. And so those are all really important factors, because it's not black and white of just like they're crying all the time or things like that. It can really look like a whole lot of different things. And so that acceptance of reducing the stigma is really important for kids to be okay with getting mental health treatment, as well as adults. And I appreciate that a lot of our schools, and with the recent legislative changes, have led to having more mental health services in the schools, which then leads to it being more mainstream, which leads to it being more acceptable. And so then it is less stigmatic, so that hopefully those kids are getting the services that they need, including in any of the schools, any of the populations that they're accessing what they need. Because if we can address that early, it can really prevent a lot of things that we see later on.
So, Dr. Grace, if you could share maybe across the board again, can we give mental health some specific names? Because I think when people hear mental health, they think of retardation or insane, so many other adjectives that really don't meet the descriptive term of what mental health encompasses.
Sure. So, of course, we see depression and anxiety. And as Amy said, depression doesn't always look like somebody crying or somebody feeling sad. There are many different symptoms that a person with depression could have. I actually read a statistic not too long ago that talked about the prevalence of anxiety with young African American teens and how that's a huge indicator for suicide. And we're starting to see more statistics come out with younger and younger children committing suicide. I can recount at least two or three stories of 9 and 10-year-old children committing suicide. But absolutely, depression, anxiety. Now, with the adolescent population, in many cases, they won't diagnose bipolar disorder or schizophrenia until they're older. But in many cases, you can certainly see some of the characteristics of those mental health disorders sort of coming to the forefront.
Wow.
But most often, in my experience, I deal with a lot of depression and anxiety.
Wow. Help me a little bit more, doctor, with something that I don't think people pay particular attention to. I was fortunate enough to study it, doing research development for WT, AMU, where we studied specific learning disabilities. How does traumatic brain injury play a part in the fact that some of these kids may have, somewhere in their infancy, had a bad fall off of a bed and the mom just picked it up off the bed, off the floor, and said, "Quit crying, you'll be okay"? And can you talk about TBI for just a second?
That's huge. And again, in many cases, these children are misdiagnosed, and that is a huge factor when you think about cultural competence and other things in the mental health field. That's a big reason that African Americans they don't trust health professionals because oftentimes there's a misdiagnosis, and so when you're misdiagnosed, you don't get the proper treatment. So again, I actually worked with a family, provided therapy for a mother with young children, and all of her children were diagnosed, and the diagnosis was ADHD. But along the time that I was in therapy with this family, it was very evident that there was some trauma that happened. But again, it comes out as behavior issues, anger, other things of that nature. So there's certainly many children who are misdiagnosed when it's actually a traumatic brain injury.
Segue into one of the other things that we've seen locally here of late, and it's a national problem or issue, and that is homicide. Just within the last 24 hours, North Heights Hamlet, Amarillo, Texas, has experienced another young millennial who has lost his life to gun violence. And I'm going to ask Neeshuh to hone in on how can we reach that age group in regards to grief processing. How can we help our community? Our community is grieving. And I think we continue to look at it as if it's just another Facebook, put the gun down, pray for so-and-so and so-and-so, stop the violence. But there is a process called grief. And what do you suggest we do as a community to help with that?
I suggest as a community, there should be no backlash about talking about the grieving. No one can tell you how long to grieve or what you should do when you lose a family member or how you should go about it. Everyone grieves differently. And so in this day and age, I believe if we stick together as one, then we can I'm trying to think of this the best way that I can, or try to word it the best way that I can. If we don't stand for something as a community, we will fall for anything. And we need to come together as one and make something come of this. Like, this has got to stop. This is, I don't know how many deaths this year already. This has got to stop. Like, gun violence is something that is a major topic. And it's like, it's senseless, it's pointless. Like, what is the reasoning behind this? And if we don't make a stop to it, our community is going to die. And they're slowly dying now. And it's just like day after day, it's something. And you can't talk at people. You have to speak to them in terms that they will understand. And as far as like homiciding and trying to stop the gun violence, there has got to be like laws or something put in place that can possibly put a start to stopping all of this.
Wow. And, I feel you empathically. I could feel your pain. And it's a painful place to watch young people grow up. And, too often we're seeing gone too soon. And that's commonplace in a town called Amarillo, Texas right now. And I think people are thinking it's Amarillo, but it's behavioral modification needs. It's people who I would also factor in some of the crime being related to poverty and lack of job security. And most of these young people, and a lot of men, are recidivism statistics, and they come out of incarcerations with the Texas Department of Corrections. And we live in a country that says you can't work here anymore. You can't do this. You can't have the social opportunities and freedoms that you were supposed to have had before you committed a felonious crime, if you will. And I think we have to work on being advocates and voices for, please allow these people an opportunity to come back into mainstream society and be an integral part of positive and productive means by way of employment, if anything. And so, Amy, I'm going to ask you to hone in on grief processing.
Well, it's grief is very complicated and it's very much individualized. And so Neeshuh and I could have both lost maybe our fathers or our grandfathers, but our experience could be very, very different. And so we can't ever assume what someone's path is going to look like when they're grieving, but it definitely, even in the diagnostic statistical manual, it used to be if someone has grieved longer than this amount and they're displaying depression, then it goes into something else. And it is clarified now that grief has no term limit, which I'm so grateful for, because we know that it doesn't. There are people that feel like they're having a good day and then they come back, the next hour and it's traumatic for them and they're struggling, or they've got a memory of their loved one. So many things, it's very complicated. But when things like homicide or suicide and someone dies of unnatural causes, it has a far more reaching impact. It's estimated, I think the National Alliance on Mental Illness estimates that for every one suicide, approximately 115 people are closely impacted. So not just like I heard about that suicide, but really deeply impacted. And if you think about a child dying by suicide, then that classroom is impacted. The secretary who has to take their name out of the computer is impacted. Their teachers, their soccer playmates, all of those people are impacted, and they are then at risk for suicide themselves. And so I don't have the statistics on homicide, but I would venture to guess that looks very similar, because it's not natural and it leaves someone with feelings of guilt and revenge and all these other things that really complicate the grief. And so it makes it look very different. And it's not that when you lose someone of natural causes that it's not hard, but this makes it all the more complicated.
It becomes traumatic.
Yes, and then it becomes traumatic. So
Yes.
The why and why did I not see it, and so many of the questions. And I've seen people that are very minimally involved with the deceased that died by suicide and still have a lot of blame. If I had just reached out, or if I had just done this. And so when we've seen cases in our communities of suicide homicides that occur, then it's just devastating, and what happens to the kids that get left behind. And so they're forever impacted. And even if it's the homicide of one of their parents, they're still left basically orphaned because one parent's incarcerated, one parent is gone. And so it's really difficult. But a lot of those things, like we said, come back to not just that in the moment, but way back. Why wasn't somebody able to cope? Why are they struggling so much that they see that that's their outlet is either suicide or to homicide? And so that early intervention is huge. And you mentioned something about poverty, and while mental illness is definitely organic, just like Dr. Grace pointed out, same thing as if you broke an arm or have diabetes or something. But at the same time, those sociological factors, so poverty, lack of access to health care, growing up in an abusive home or different things like that, are definitely major contributors. And so the more we can create healthy communities, then the better naturally coping people can have. But it's also just in general really encouraging access to mental health and making it okay to get that. About 30% of African Americans with a mental illness will seek treatment. And so that means 70% are going without treatment, and that's not good. It's not good for their Caucasian counterparts, which are at 43%, but it shows that they're a little bit more likely to seek treatment.
And I hunt in here again to say this. I see so many of our family and friends in that 70% statistic that actually need mental health attention or counseling. And I have this year made it a point to tell myself, I will not tell me that I'm being judgmental of a fruit that I know what it's bearing. And we as young men and women, older men and women, in Hamlet Heights, and I'm going to specify that, we have to do something about mental health. We have to do something about depression, low self-esteem. We have to do something about our faith. There are too many people who are attending church services, getting emotional and not having the behavioral modification changes conducive to that of coming out of old behaviors. Let's just borrow from the scripture. Coming from being conformed to a world and being transformed by the renewing of our minds. And my prayer is for transformation. And so on that note, I'm going to ask Dr. Grace to wrap us up here for the next 2 minutes on what would you suggest we do as a community in regards to addressing getting more interest into mental health in our communities.
Absolutely. So we must address this as basically a crisis, a community crisis. And I think the way in which we can begin is obviously having these conversations. We also have to create safe spaces, whether that's in the faith community, rec centers. We have to provide families and children with an opportunity to even have these conversations. We have to start with education. We have to let people know and understand that mental illness is not just you being crazy, or it's not this label you have to walk around with, on your chest, that it's normal that many people have mental illness and that you can live a normal life. It doesn't have to be the city that follows you around. So we definitely have to create safe conversations. We have to provide education, and we need the resources, honestly. We need access. Many people don't have health insurance and can't afford to access mental health services. So those are some areas where we can start.
Thank you so much, Dr. Grace. Thank you, Amy Hord. Thank you, Neeshuh Williams. Thank you, Garrett, who nobody gets to see here, for helping with the production side of this. This is imperative that we have a dialogue. I am very, very grateful. I just thank God for conversations, simply because we get to come in and we get to have a decent conversations. We're not worried about likes. We're not worried about emoji. We're more concerned with a conversation that is brain stemming and stems the interest of people who otherwise may not have an opportunity to find or to address the issue of, I now know a little bit more about what mental health is. I now know a little bit more of what grief means, and I don't have to stop grieving when people think I should stop. And so a plethora of insights that we've garnered from this show. Again, we're conversations. We are a dialogue and never a debate, and we will be back with you for another segment sometime soon. Thank you for joining Conversations. I'm going to ask Amy to share some insight of something that's dear on her heart, and just let us roll with it.
Sure. Well, one of the things across various races is one of the obstacles to seeking mental health treatment is faith. And you think faith is always a strength. And that's definitely something when we do counseling, if someone has particular spiritual beliefs, that can really play in a strength in their treatment goals. And it made me think about when Neeshuh was talking about faith first and then community, family, and those are a lot of the reasons that at least the studies show that African Americans seek out those things for support, which is fantastic, and they should. But if that's not taking care of it, it could truly be something that's organic. And that's something that we can just pray and pray and pray and hope for that. But sometimes God gives us those things to be able to seek out and get treatment. But the other thing too is it is really hard if you're struggling with anxiety or depression to really get the full benefit of your faith. So I know that personally, when my anxiety has been kind of off the charts, then it's really hard for me to pray. It's really hard for me to be in the Word, or it's hard to do any of those things that would give me the benefit of that spiritual support and strength. And so if that's something that someone's experiencing, it may be worth looking at it from a different lens of, am I just not leaning on God enough, or is this more about an opportunity for me to dive deeper into Him if my mental health is where it could be that I could really experience that?
I agree wholeheartedly, Amy. My faith is Christian. And one of my major experiences in the past 20 years of life have been watching people who have in their heads that there is a scripture that will modify their behavior. It will save their souls. It will be the change that they're looking for. And so a lot of them attend church on a regular basis. And it is my opinion that far too many people with mental health issues find religion and not relationship. Mm-hmm. Because the Christian faith is about the attributes of a Christ who was a Jehovah Rapha, a healer. Mm-hmm. And so when we go to New Testament scriptures, it says, what does it profit one to gain access to the world and its pleasures and lose the soul? Mm-hmm. The soul is three component parts: the mind, the emotion, and the will. Having alluded to the book of Romans, 12:1, says, I beseech you, brethren, by the mercies of God, that you present your bodies a living sacrifice, wholly acceptable unto God, which is your reasonable service, which is the least you can do. Mm-hmm. Then it goes on to say, and be not conformed to the world, mm-hmm. but be ye transformed by the renewing of your minds. Mm-hmm. And the renewing of the mind has to pick up on the Christ portion that says, let this mind be in you, which was also in Christ, the Messiah. And so what I get from that I've been sharing with people, and I work with a group I counsel life coach, let me put it in that context. I life coach a group of people where I have to ask them to pay particular attention to the fact that you are emotional in church, but you are an alcoholic. Mm-hmm. You are emotional in church and you're up and down, but you have a substance abuse chemical dependence on opioids and or some type of smoke. And they have a tendency to say, you're judging me. You don't, how do you know that? It is in the fruit. See, when we reference Christ as wonderful counselor, his revelation is revealing those things that you and all of us sitting here have an opportunity to address and say, okay, I've seen the problem. Are you ready for the solution? When the student is ready, the teacher will appear. And I find too many adults who are in denial and covering it up with some type of religious attribute. And denial is not a river in Egypt. And I pray to God that the age group between 25 and 60 would pay particular attention to one of the major problems in society as a whole is chemical dependency. Alcohol abuse and drug abuse are symptoms that there are other underlying issues.
Agree.
From social anxiety disorder. And I have never been more enamored with someone bringing this topic up. And I think you were wondering, should I bring this? Always bring it, because I don't want to overtalk things. And it's not, we cannot deny the fact that a lot of our young people find their behaviors from older people. And if they see older people 2 doors down drinking and having a party and popping and smoking, they're thinking like, that's what you call fun. And before you know it, you got them stealing the alcohol and the drugs, and they learn how to change how they feel because that's what most people do not know that alcohol is termed a distilled spirit. And so when you think of a spirit, you got to figure out which spirit. Because there's a spirit that can go inside of us and make us fall asleep at a wheel. And there's a spirit that can come inside of us and drive us in the direction of being happy, joyous, joyful, and free from depending on something other than the power, and I'm going to go there, a risen Savior. So now, there comes my emotion. Because I truly believe that until we see Jesus Christ in the 21st century, we keep going to reference this Jesus. And by the way, Christ is not his last name. Christ became the Messiah. And Christ became the reason that we have a hope and a future. And he's the same yesterday, today, and forever. But that same is all encompassing of helping us change. No change, no chance. And I appreciate you ladies for being here in the studio tonight. And what an amazing conversation we get to have, because I truly believe that this is God ordained, and people who want help will glean from this conversation. So Amy, Neeshuh, and Dr. Grace, thank you all. Thank you,
Thank you.
Garrett.
Thank you.
And we'll be back soon.